waiting for the movie studios to call me about the Asian Rudy movie. Haven't gotten the call yet. Thank you for inviting me, Milton. And my name is Michael. I'm the CEO of Curogram. We're the smart patient texting platform. We're also a universal messaging platform that allows everything from offices to communicate with patients, doctors to communicate with other doctors, offices to communicate with other offices. During my presentation, I'm going to show my mobile number here. It's on every slide. If you have a question, feel free to text me during the presentation. That way, during the Q&A section, I can pull that up and try and answer. And if I can't get to it, if we run out of time, at least I'll have a record. I can reach out to you to answer your question. So my topic here is patient consumerism and the role of text messaging. And talking about patient consumerism, you guys all have heard this trend, and the question is it really that important? Well, the healthcare consulting firm Sage Growth Partners did a study with 100 leaders and found that 69% of them list consumerism as a top priority. So if you're in the 31% that isn't worried about it, you might want to reconsider and try and understand what you need to do to address these issues coming. And what does it mean? What is patient consumerism? Well, it's the shift in the role of the patient from being just a passive participant in the healthcare market to an active consumer. And it's the shift from prescriptive care to a model of patient choice. What are the factors driving this change? Well, one of the big ones is an increase in high deductible plans and health saving plans that are now putting the patients in the driver's seat, because now they're spending the money directly out of their pocket first, and they now are a lot more interested in their decision-making process, and they're taking a much more active role in choosing which providers they go to, what services they take on. And also the shift from fee-for-service to value-based care is pushing providers to think about their patients more as consumers and not just patients. So what does this shift mean, this trend mean for providers? Well, it means they need to focus more on patient satisfaction, clinical quality, and cost transparency. But the number one focus that they need to worry about is patient satisfaction. And what do patient consumers want? Well, NRC Health did a study that found today convenience is now the number one factor that influences which provider a consumer will select. That's a big statement to say that convenience is number one. I think some people might think, oh, it's the quality of the clinic, maybe it's the quality of the care, the facilities, but right now convenience is the number one factor. And so at Curogram, we kind of coined this internal term C squared in terms of convenience and communication, because both convenience and communication are tied at the hip. A lot of times, convenience for a patient means improved communication. So now that we know what they don't want, or we know what patients want, I'm going to tell you what they don't want, and that's they don't want to talk on the phone. And why is that? It's because it's one of the most inconvenient forms of communication. Patients are dealing with annoying phone trees, and first of all, they start the call with an annoying phone tree, and then after already losing time listening to that phone tree, they get put on hold. And I've talked to some large healthcare organizations who have told me their wait times in their call centers for a patient just to schedule an appointment is up to 30 minutes, which is astonishing to me because I would be distraught after 1 minute of being on hold. And then there's the dreaded voicemail, right? And as a consumer, patients dread leaving a voicemail because they don't believe that it's going to be responded to in a timely manner. And why do we believe? We all believe that because probably I'm sure all of you here don't check your voicemail that regularly anymore. I know on my phone, I've probably got 0 unread messages, 30 unlistened to voicemails, and thousands of unread emails. So the funny thing is that medical offices and their staff, they don't want to talk on the phone either. And why is that? It's because it's time consuming. I mean, you have patients calling in, they want to tell you about, their their life story or what happened to their cat yesterday, and that's taking up multiple minutes just hearing that. It interrupts the workflow. As a patient calls in, if you're checking in a patient at the front desk and the phone rings, you have to answer it. So what do? You annoy the patient that's sitting in front of you because you just interrupted them, and then now you got to put the patient that called in on the phone on hold, and now they're annoyed. And again, the offices, they struggle with voicemail tag too, because when they have to call the patient for something, maybe to communicate test results or to communicate something about the schedule change, generally, I'm sure very few of you have your doctor's office phone number stored in your contacts. So that means when that call comes in, it's from an unlisted number, which could be a telemarketer, right? And none of us answer these calls anymore unless they come with a name in our contact database. So offices are struggling with contacting patients via phone. And then it's ultimately a source of stress for staff that are on the phone all day talking to patients all day long. So getting back to this concept of convenience and communication, how can you serve both? How can you provide convenience and improve communication? Well, the answer is less phone calls. And the answer to less phone calls is text messaging. Text messaging is the new norm, and we all know this. We all here prefer to text over any other form of communication, and the statistics really tell the story. 90% of text messages are read within 3 minutes, versus only 60% of emails are read within 24 hours. And then only 30% of phone calls are actually answered when it comes from an unlisted number. So I'll give a quick side note, anecdote of how pervasive texting has become. My mother is in her 70s, and she doesn't even call me anymore. She texts me. And she's learned that if she calls me during the day, I don't pick it up. I don't pick up the call because I'm busy at work. If she calls me at night, sometimes I'm busy taking care of the kids. So literally now, she's texting me all day long, all night long. But the reality is, I text her back within 5 minutes. So she's happy with that. So if my 70-year-old mother can figure out how to text me, my doctor's office should probably figure out how to do it too. And that's the reality. And at Curogram, we believe that texting is the future of patient communication. Patients are already demanding it, and it's not only valuable to them as the patient, but it's valuable to the healthcare organization because it reduces your communication time by as much as 90%. And just consider a typical phone call that can tie up 3 minutes of a staff's time. Generally, the communication happening in that 3-minute span can be dealt with in less than 20 seconds via text messaging. Some of the common use cases we're seeing with our client base and using our text messaging platform, they're using it to confirm appointments, they're using it to book appointments for patients, they're coordinating schedule changes, they're answering pre-visit, post-visit questions, they're sending mobile-friendly electronic patient forms ahead of time. In some cases, these are extensive forms, and they're getting patients to fill them out on their phone in advance. They're answering prescription refill requests, they're requesting online payments, and they're getting automated 5-star reviews online. And we have clients who started with us with 10 reviews on Google, for example, and in 9 months, they're over 370 reviews, 5-star average. And one of our larger clients, in the first 30 days of onboarding with us, using that text messaging feature, they were able to add over 1,100 5-star reviews across all 30 locations of their organization within the first 30 days. And a lot of these features in our platform are a mix of automation and custom two-way texting between either the front desk staff in an office and the patient, or a call center team and call center agents and patients. I'll give a couple quick case studies before I move on to questions. This one is a high-volume clinic client that has 11 locations. They have a central call center where they do a lot of scheduling coordination, but they also do coordination at the local office level. So they're using our platform at both the call center and local office. They're getting an 80% patient response rate on SMS, 40% response rate on digital form requests, and their forms are extensive. They have 12 forms that patients need to fill out before they come in, and they're getting full submissions. They've also reduced incoming phone calls by as much as 50%. And this is huge because the reality is patients don't want to call you. So if you give them a way to text you, they will. Another study, this is a larger physician group, 60 doctors, 600 staff, 30 locations I mentioned. They have central call center and local offices. They're getting a 70% patient response rate across the entire organization. And right now they're projecting a 20% reduction in call center staff. So what about texting and telemedicine? How are they intertwined? Well, we're seeing applications with our different clients related to telemedicine in remote patient monitoring, in research studies, and as a bridging tool to video visits. So one example here, Texas Center for Lifestyle Medicine, they're using the product, our platform, just to communicate with patients, and they're successfully migrating patients off of insulin by prescribing lifestyle dietary changes, but then they're managing that care via our HIPAA-compliant text messaging, and they're having patients text in their blood sugar levels as they're changing their diet, changing their lifestyle, and that's important because, one, they're helping them to reduce the medication burden, but they're also preventing hospitalization because in some cases, if the patients actually make those drastic lifestyle and dietary changes, their medication levels can be too high, so they're preventing over-medication. And they've successfully migrated a number of patients off using this method. And this is in conjunction with their other RPM platforms that they're using. So it's really, our texting tool is a complementary tool to other telemedicine tools that they're using. An example of being used in research studies, Ablative Solutions has a clinical trial called Target BP1 for their alcohol-mediated renal denervation procedure. And they've got 30 sites nationally. They're piloting texting one of their sites as an initial tool for engaging potential trial candidates and then monitoring results again via text. And last here, and then I'll turn it over. Another client, Dr. Asif Ali, Houston cardiology consultant, who I know has spoken here at this event multiple times. He's using VSee for video visits, first with patients at ER locations, but then he's transitioning those patients to in-clinic care at his location using text message coordination. And then once they're now in his care, he's using our platform to engage with patients on a daily basis via text messaging, and then when it's appropriate and they need to be transitioned to a video call for telemedicine visit, he has a very simple communication medium that he can use to transition them to that video visit. And that's an example of a use case of combining text messaging with telemedicine. So I think my time is up. I'll leave it to
Michael,
Milton.
thank you so much. Maybe we had time for one question.
Can text messaging be truly HIPAA compliant?
Absolutely. So in our platform, one thing we do different than other platforms is we've combined both SMS, HIPAA compliant SMS messaging, and encrypted app messaging. And so on our platform, there's certain things that people coordinate via SMS, scheduling, appointments, simple instructions, pre-visit instructions. But then if they want to transition that conversation to a PHI-based conversation, in the same dashboard, we give them an option just to click a button that says, hey, this is PHI, we're going to encrypt this. And so when that message goes out, the patient actually still gets an SMS notification, but now it says, hey, this is a secure message or a conversation. We need you to download the app to view this conversation. So you give you the ability to do both.
Great. Thank you so much. Very cool.
Thank you.